The title of this talk is The Ventricular System, Part 1. Medical students need to recognize the ventricles and related structures viewed from different visual angles. We will start with the lateral view. Here you see a lateral view of the brain. This is a transparent representation of the brain and the cerebrospinal fluid field. You can see the frontal, temporal, and occipital poles. This is ventricle number 1, ventricle number 2, ventricle number 3, and ventricle number 4. The confusion is to label the right hemisphere ventricle 1 and the left hemisphere ventricle 2, or vice versa, led to the wise decision of calling this ventricle by their full name. So now we talk about left lateral ventricle and right lateral ventricle. In the lateral ventricles, and we will use the left ventricle as an example, we find the anterior horn, body, posterior horn, the inferior horn, and the trigone. The trigone, or atrium, is the area where all three horns meet. The same components are obviously found in the right lateral ventricle. Between the lateral ventricles and the third ventricle, we find the foramina of Monro. The third ventricle's shape has been compared with a duck eating a fish. As you can see in this frame, the upper beak forms the supraoptic recess and the lower beak forms the infundibular recess. Posterior, we have the suprapineal recess and the pineal recess. The mass intermedia is a body of tissue that communicates the right and the left thalamus. Next, we have the aqueduct of Sylvius. The aqueduct of Sylvius communicates the third and the fourth ventricle. The aqueduct of Sylvius is a thin conduit ventral to the tectum or roof of the midbrain and dorsal to the midbrain tegmentum, as you see in this insert. So the aqueduct of Sylvius communicates the third and the fourth ventricles. The fourth ventricle is an odd-shaped structure which can only be fully appreciated in a 3D rendition. But the drawings of Cunningham's made in 1918 provide a good rendition of the fourth ventricle and the lateral recess pointed by the arrow. The fourth ventricle has a median aperture called the foramen of Magendie and a lateral recess to which we have already alluded that at its end has an aperture called the foramen of Luschka. The position of these foramina in relation to each other is easy to remember. Think of the M in Magendie for median and the L in Luschka for lateral. As you can see in this specimen, the anterior medullary velum forms the roof of the upper part of the fourth ventricle. The caudal part of the anterior medullary velum contains the lingual of the cerebellar vermis. The posterior medullary velum forms the roof of the lower fourth ventricle. The posterior medullary velum melts into the nodule of the cerebellar vermis. The floor of the fourth ventricle is the medullary and pontine tegmentum, as you see in this insert. Now let's go back to the transparent brain image to show the exiting of CSF from the ventricular system into the supranuclear space. The arrows here presented indicate the route of CSF follows to reach the upper mid-sagittal region of the cranial vault, from where it is absorbed. This absorption takes place by the arachnoid granulations. In this frame, you can see the schematic and real characteristic of the arachnoid granulations. They simply work as one-way valves that traverse the inner dura, allowing CSF to go from the supranuclear space to the superior sagittal sinus and venous lacunas surrounding it, thus providing one-way path for CSF to join the regular circulation. Now, I like to illustrate the ventricles from the top view. Here, as you can see, I have indicated the frontal and occipital poles. Now, the fourth ventricle, the lateral recess, ending in the foramina of Luschka, the third ventricle, and the lateral ventricles. In the lateral ventricles, we can see in this view the body, the anterior horn, the posterior horn, and the inferior horn. We can also see the trigone, as you can see in this frame. Now we're going to move to the anterior view of the ventricles. With the brain in the anatomical position, you can see that the anterior horn of the left lateral ventricle being pointed by the arrow, the body of the right lateral ventricle, the inferior horn of the right lateral ventricle, the left ventricle posterior horn, and the left lateral recess of the fourth ventricle. I have now indicated the foramina of Monro. This is an MRI showing lesions close to the foramina of Monro, one on one side and another one in the other side. This pattern is very characteristic of tuberous sclerosis. Now let's talk about structures that abut the lateral and third ventricles. In this brain specimen, the ventricle have been exposed. The rectangle I have just added and now enlarged shows the histology of a row of ependymal cells with their typical hairy surface. These cells line the ventricles and the foramina's wall. The arrow indicates the ventricular bulge made by the caudate, which I have delineated in this frame to indicate the head, body, and tail of the caudate nucleus. Just below the head of the caudate, as indicated by the arrow, we have the hypothalamus, which I have traced, as you can see in this frame. Behind the hypothalamus and just below, a little back to the body of the lateral ventricle, we can see the bulging of the thalamus, which I have traced in this frame to indicate the mass intermedia, the anterior nucleus of the thalamus, and the pulvinar nucleus. This is a top view of the open lateral ventricles with minimal representation of the surrounding telencephalon. I have indicated the left lateral ventricle and the third ventricle, the left foramen of Monro, the bulge produced by the caudate nucleus, and the thalamus. I am enclosing a drawing from 1918, again from the same book, depicting the view captured in the later specimen. It is not meant for you to read any of the names inscribed in this picture, but just to admire it. Now, in the right upper corner of this frame, I am representing the transparent image of the brain, as you can see. Now I'm putting a midline sagittal cut represented by the yellow structure and a transverse cut at the level indicated. I have now discarded the area separated by the cuts so we can see the mesial aspect of the corpus callosum and the floor of the inferior horn of the left lateral ventricle. In this specimen, you can see the hippocampus, and in front of the hippocampus you can see a meaty structure that is called the amygdala. This specimen corresponds to a close-up of the area just shown. In it you find the amygdala, which, as you can see, has been cut. Here I am pointing to the hippocampus. And in the back, at the level of the posterior horn, you can get a partial look at the calcar avus. Again, I will show you an image from Conigan's book indicating the hippocampus and the calcar avus. You can see in this drawing why earlier anatomists called the calcar avus the little hippocampus, a term no longer used. This is a view of the occipital horn of the lateral ventricles to show you the calcar avus on both sides and to show you what causes the bulge we call the calcar avus, which is the deep penetration of the calcarine sulcus into the occipital parenchyma. In this view, you can also observe the calcar avus. In this video, we will only describe the classical explanation for where CSF is produced. This issue will be discussed further in a video titled The Ventricular System Part 2. I find this diagram useful when talking about CSF in general, so I will present it to you. The top rectangle represents the lateral ventricle. The lower rectangle in cream color represents the right lateral ventricle. They are considered telencephalic ventricles. The circle represents the third ventricle, which is considered the diencephalic ventricle. The connection between the left lateral ventricle and the third ventricle is the left foramen of Monro. The triangular structure is the fourth ventricle. The ventricle is considered the rhomboencephalic ventricle. I have now introduced a set of red lines to indicate the location of the choroid plexus. The choroid plexus is the source of CSF. The choroid plexus is present at the lower portion of the roof of the fourth ventricle, as you can see in this specimen pointed by the arrow. The choroid plexus is also present at the top of the third ventricle, as you can see in this frame to which I am pointing in this specimen. Notice that it is a granular looking structure that is attached to the roof of the third ventricle. Choroid plexus is also present in the foramina of Monro. Going back to the specimen I showed you before, with a little bit of imagination you can see the choroid plexus coming out of the foramina. The fourth major location of the choroid plexus is the lateral ventricle. Not only the choroid plexus is present at the floor of the anterior horn and body of the lateral ventricle, but also it is attached to the roof of the inferior horn of the lateral ventricle. In this video, we will only discuss the classical explanation for how CSF is produced. This issue will be discussed further in a video titled The Ventricular System Part 2. I hope you are familiar with this specimen. To use it again, to tell you about CSF production. Here I am indicating a piece of the choroid plexus. I will now select a small part of it to illustrate some of the components of the choroid plexus. The basic components of the choroid plexus are capillaries, stroma, pia, and epithelial cells. Notice that the epithelial cells are joined by tight junctions that block the free flow of substrate from the stroma to the CSF and vice versa. I will use this diagram we have drawn before to explain CSF production. Key to CSF production is the choroid plexus epithelial cell. The choroid plexus capillary, unlike other capillaries in the CNS, have holes which allow leakage of plasma. The plasma ultrafiltrate goes through the stroma and the pia to be taken up by the choroid plexus epithelium. The choroidal epithelial cell has a machinery that processes the plasma ultrafiltrate, which is after processing released to the CSF. The choroid plexus produces about 500 ml per day of CSF. The CSF constitutes about 10% of the intracranial volume. In adults, normal CSF has less than 5 lymphocyte or red cells per microliter. Glucose is usually 40 to 80 milligrams per deciliter, which is about 40% of the simultaneously measured sugar plasma levels. Myelin basic protein is less than 1.5 nanograms per ml. The total protein is about 15 to 60 milligrams per deciliter. In this video, we will only describe the classical explanation for CSF circulation. This issue will be discussed further in a video titled The Ventricular System Part 2. I have brought back the diagram I used to explain the location of the choroid plexus to tell you about CSF circulation. CSF is produced by the choroid plexus present at the locations previously indicated. The CSF produced in the lateral ventricles goes through the foramina of Monro to the third ventricle, where it joins the CSF produced by the choroid plexus of the third ventricle and a minimal amount of CSF produced at the foramen of Monro. Here it goes through the aqueduct of Sylvius, which is a mesencephalic conduit which corresponds to the midbrain, as we have previously seen, and joins the CSF produced in the fourth ventricle, exiting the ventricular compartment by way of the foramen of Magendie and the foramina of Luschka. In this video, we will only describe the classical explanation for CSF reabsorption. This issue will be discussed further in a video titled The Ventricular System Part 2. After CSF leaves the ventricular system, it circulates in the supraarachnoid space and cisterns and travels in the direction of the superior sagittal sinus, often known as the SSS. There, the arachnoid granulations or villi are maximally represented, as we mentioned earlier in this talk. It is through these structures that the CSF enters the venous circulation at a rate of 150 ml per 6 to 8 hours. We will finish this talk by talking about frequent sites and anatomical consequence of CSF obstructions. I hope you have a clear understanding of this diagram because I will use it for this section. An obstruction at the right foramen of Monro produces, as shown in this MRI, lack of CSF flow through it, leading to enlargement of the anterior and posterior segments of the lateral ventricles, in this case of the right lateral ventricle. An obstruction that occurs at the aqueduct of Sylvius, as indicated by the arrow, will be accompanied by ventricular dilatation of both lateral ventricles and the third ventricle. The size of the fourth ventricle will be normal. This is an example of a patient with aqueductal stenosis showing a large head. Now you see a picture denoting a positive transillumination test. A light source applied on the opposite side goes through the head because the ventricles are dilated, and CSF, unlike brain parenchyma, allows light to go through. The final site of obstruction I want to mention to you is in the foramen of Magendie and the foraminas of Luschka. An obstruction at these sites in the area pointed by the arrow, dilatation of the fourth ventricle, third ventricle, and lateral ventricles. The supraarachnoid space will be reduced. Thank you very much for your attention.